What if a patient walked into your clinic with a cold so violent that the water dripping from their nose was literally burning a raw red line into their upper lip? They are sneezing constantly, their eyes are pouring tears, and they are suffocating inside a warm room. Today, we are opening the clinical diary of classical homeopathy to master Allium Cepa, and I am going to show you the one diagnostic secret that prevents 90% of prescribing mistakes with this remedy. Let's write it down. Now that we have opened our diary, let's look at the absolute clinical foundation of Allium Cepa. The core keynote of this remedy is acrid nasal discharge. In classical homeopathy, the word acrid means corrosive, burning, and acidic. When an Allium Cepa patient catches a head cold or suffers an acute attack of hay fever, the watery fluid pouring from their nose is highly alkaline and sharp. As it drips down, it chemically irritates the skin. When this patient sits in your consulting chair, you will immediately notice that the skin around their nostrils and their entire upper lip is raw, red, sore, and highly sensitive to the touch. They cannot even wipe their nose with a soft tissue without crying out in pain. The sneezing is violent, continuous, and starts the very moment they are exposed to any warm atmosphere. If you see a dripping cold combined with a painfully excoriated upper lip, your prescription is almost always Allium Cepa. Let's look at the eyes because this is where the diagnostic trap lies, and it is exactly how you tell this remedy apart from its closest lookalikes. While the nose is burning and raw, the patient's eyes are also streaming profusely with tears. Water is literally running down their cheeks, their eyelids are red, and they are blinking constantly. But here is the major clinical gem. The discharge from the eyes is completely bland and mild. It does not corrode the skin of the face. The tears are just clear, harmless water. This is the exact perfect opposite of the euphrasia. In euphrasia, the nasal discharge is mild and harmless, but the tears from the eyes are highly acrid, leaving red, burning tracks down the cheeks. Remember this simple rule. Allium Cepa has a burning nose and peaceful eyes. Euphrasia has a peaceful nose and burning eyes. Writing this single distinction in your diary will instantly elevate your prescribing accuracy. Now, let's talk about temperature modalities, which are the triggers that control the patient's suffering. The Allium Cepa patient is extremely sensitive to thermal changes. They are dramatically worse in a warm room or during the quiet evening hours. If they sit near a fireplace, a heater, or even in a closed, cozy room, their nasal passages will instantly swell, their nose will run like an open tap, and they will experience a heavy, throbbing headache. But the very second they step outside into an open, cool air, a beautiful change occurs. The dripping slows down, the nasal congestion clears, and they can breathe freely. Physically, we also see this remedy act deeply on the larynx. If the cold moves down into the chest, it produces a dry, hacking cough. This cough is triggered by an intense tickling in the windpipe, and it is so violent and painful that the patient will physically grab their throat with both hands because they feel like their larynx is going to split wide open when they cough. To summarize this brilliant remedy, always look for these three essential Allium Cepa pillars. First, a fluent, watery nasal discharge that is highly burning and corrodes the upper lip. Second, profuse watering of the eyes that is completely mild and does not burn the cheeks. And third, a patient who suffers heavily inside a warm room but finds instant, beautiful relief out in the cool open air. Keeping these clinical notes close to you will help you stop an acute allergy attacks in its tracks. Thank you so much for sitting down and writing out these beautiful clinical gems with me today. If you enjoyed this high energy handwritten approach to exploring classical materia magica, please hit that like button, subscribe to Dr. Kainaat Homeopath, and drop a comment below letting me know which remedy we should study together next. As we wrap up today's session, please take a moment to read the important note on your screen. This video is created strictly for educational and informational purposes. Homeopathy is a highly precise science based on individual symptom matching. So, please do not self-medicate. Always consult a registered professional practitioner or doctor for your personal health concerns. Stay safe, stay healthy, and I will see you in our next study session.